In the previous video, we have seen the McEwen's triangle, an important landmark for the mastoid antrum. So, when we started drilling at the McEwen's triangle, when you go for 1.5 centimeter deep, you get this mastoid antrum, the biggest and the most constant air cell system of the mastoid. From there, the air pockets will invaginate into the mastoid bone. These are all the different mastoid air cell systems, and these are the potential sites of the disease also. So this mastoid antrum has a communication with the middle ear through opening called as additus to the mastoid antrum. This is additus to the mastoid antrum. This will be the middle ear cavity and connected through a auditory tube, pharyngotympanic tube. From here, the air will come through the pharyngotympanic tube and aerate the middle ear and the mastoid ear cell system. Aeration is very, very important for normal functioning of the ear. This mastoid ear cell system, there are some named group of ear cells. So from the mastoid antrum, different air pockets will go into the bone and form very cellular mastoid. And sometimes this air cell system will be very less, then we call them as, or not at all there, then we call it a sclerotic mastoid. The different air cell systems seen for understanding purpose, there are cells around the mastoid antrum. They are called as periantral cells. There are cells along the roof, that is tegmen tympani, dural plate. Those are called as peridural cells. There are cells along this is the area of the sigmoid sinus. So along this sigmoid sinus plate also there are cells called as perisinus cells. And the junction between the tegmen and the dura, sinodural angle, this is a sinodural angle or Citteley's angle. There also you have some cells called as sinodural cells. There will be some cells at the tip of the mastoid. There will be cells, this is a facial canal area, there will be cells which are called along the facial nerve called as perifacial cells. And this is a labyrinthine area, we have perilabyrinthine, petrosal, and there is a cell system, there are different things also. And at least this majority of these cells you need to explore when you're doing the mastoid surgery. Once you remove all those air cells, the mastoid air cells, the mastoid cavity looks like this. This is the dural plate, this is the sigmoid sinus plate, this is the tip, and this yellow area is the labyrinthine area of the mastoid. If you go still deeper and dissect, this is the intact posterior superior canal wall. This is the additus to the antrum. You can see the ossicles there. This is the facial nerve, and this is the chorda tympani branch of the facial nerve. And between the two, when you dissect, you can get an excess. This is called as posterior tympanotomy, to go for stapes surgeries. You can see this is the short pes of incus, and here is the stapes, the posterior tympanotomy surgery.